Okay, everyone, it is 1:05, and I hope everyone is enjoying their day in addition to the kickoff of the two-day summit. So, thank you for joining the powerful IP expert panel as part of the 2026 Strategic Summits System Summit. My name is Dr. Lerenza Howard, and my work focuses on transforming healthcare systems through strategic leadership, culture change, and evidence-based safety practices. As a social architect and board certified expert in infection prevention and control, I help organizations operationalize cultures of safety and excellence while serving as brand ambassador for Dumontel Healthcare Consulting. I will be facilitating this meeting while also being a panelist. But before we convene, I will hand it over to Carol to kickstart the introductions, excuse me.
All right, thank you, Dr. Howard. It's nice to see everyone here today. I hope you've been enjoying the summit, all the sessions you were able to attend. I'm enjoying the conversations I'm hearing and my own presentations as well. And I'm glad to see that we have some people joining us today. So yeah, I'm very happy for us to go into this conversation where we will discuss how organizations can use emerging talent and turn them into their health system strength. And we're using this based on our own experience with our powerful IP coaching program that's given us a base for a case study on how that we leaders are able to make that work with their early career infection preventionists. Thank you.
Thank you. Missy, a brief introduction of yourself.
Yes, thank you so much. I'm pleased to be here today. My name is Missy Travis. I'm a registered nurse certified in infection prevention and a fellow of APIC, and I'm the founder of IP&C Consulting. I've worked in infection prevention for over 25 years across acute care hospitals, academic medical centers, inpatient rehab, long-term care, public health, behavioral health, and even some professional sports teams. Through my consulting work, I partner with healthcare providers and infection preventionists to strengthen programs, reduce risk, and build sustainable, practical infection prevention strategies that work in the real world. I'm passionate about translating guidelines into actionable steps that support frontline teams and protect patients and residents. I'm really excited to be here today and look forward to our time together in our discussion.
Thank you, Missy. And last but certainly not least, Joy.
There. My name is Joi McMillon, and I am the CEO of JAD Infection Control Experts. I have over 30 years experience in healthcare as a registered nurse, in infection prevention and control. I specialize in regulatory compliance and really in the post-acute sector. I'm a real advocate to ensure that though the resources are slimmer in post-acute and ambulatory care centers, I do a little of that, but that each person, whether they're a resident, a patient, or a client that comes in for any type of healthcare services, gets the quality that they deserve. And I think, ensuring that everyone has access and advocating and really educating. I love to educate and advocate so that everyone knows how to advocate for themselves as well. So I do a lot of engagements and public speaking so that I can ensure that the general public in community events, as well as the healthcare professionals who are carrying out the work, know the why behind what they're doing and know how to strategically ensure that they're designing systems that will help their employees, help their um, team members make sure that all of the healthcare regulations are being met and that they get quality outcomes. And that's what it's really all about. And I'm excited to be here on this team.
Absolutely. Thank you. As we convene for this summit centered on thriving under pressure, health systems built for a new era, our conversation is grounded in a shared responsibility to strengthen the systems that support safe, resilient, and high performing healthcare organizations. This panel is designed to offer practical insights for infection prevention leaders and healthcare executives on how to align infection prevention expertise with system level outcomes, workforce sustainability, and long term organizational resilience. Together, we will explore how elevating infection prevention as a strategic capability can help health systems not only respond to pressure, but truly thrive within it. All right, so let's dive right in. The first question is for everyone is how can IP leaders influence enterprise level alignment between leadership, teams, and organizational goals? And Joy, if you wanted to start us off.
Well, we really want to make sure that that alignment is done like we were saying earlier, strategically. And when I say strategically, it's the initial design and looking at each step. I think that it's very important to uh, do things like failure modes and risk assessments to see exactly systematically each step that needs to be done and how it should be done, and look at the total process. You really have to begin from really the bedside, the clinical area, and walk through the process. As I have been assisting leaders to transform their organizations, and it's very easy for people to look at a process and say, well, we're just going to roll this out. Well, the reality is you really need to stop. It's very great to do a time study in what's practical and what's expected versus what people are actually doing, so that you can put in place efficiencies that are going to help them have things designed in such a way that when they go to reach for their supplies are where they need them to be, and they're not having to improvise, and because that's where drift happens. And so we want to strategically set them up for success without them having to think about it. Have automated things that consistently support the evidence-based practice that is expected.
Thank you. And then same question, Missy. What are your insights? Absolutely. What Joy noted is that you're interfacing the regulatory guidelines, evidence-based practice, however, incorporating that within the daily workflow. So what is your assessment of how can IP leaders influence enterprise level alignments?
Yeah, I think this is an important question. And as IPs, we kind of sit at that intersection between people, the environment, and infection prevention. And that puts us in a very unique position because we work across almost every department in the healthcare facility. And it gives us visibility into how those processes connect. We can sometimes follow the entire process down the line because we are working with each of those different departments and looking to see that they're following all the infection prevention principles and guidelines. And one of the most effective ways I think IP leaders create alignment is by connecting that infection prevention work to the organizational priorities and also the departmental priorities, because oftentimes departments will get into their own silo and get very focused on just what they are trying to do, where we have that objective view that we are seeing the big picture and we can start connecting those dots for them to show them if you miss this right here, then it's going to impact this department over here. We see this with isolation all the time, where someone misses it here and then we see the effects down here with an exposure. And so I think by trying to proactively connect those processes at the beginning and try to train people to start seeing how we all help each other and we're all related. And we really can bring those disciplines together. So it's not just one department's responsibility, and infection prevention really becomes a part of the system overall.
Absolutely. That you made definitely an important point in breaking down those silos and that multidisciplinary collaboration to ensure that infection prevention best practices are intertwined within all daily workflows, not just a specific department. So, Carol, share some of your insights related to this inquiry.
Yes, thank you. Excuse me. Uh, I agree with what both ladies said, and to piggyback on what Missy said, infection prevention is really at a strategic point for it in your organization, and it has a vantage point into every department. And I'm going to shift it a little bit in my response from a business mindset. What we've learned for all of us who have technical training, we started in the clinical world, all wanting to make a difference and take care of patients. And one thing I've realized with time is in countries like the US, for example, healthcare really is a business. So for infection prevention leaders to help their organization leaders to see infection prevention as a strategic asset for the organization, there also needs to be a business mindset, knowing what the executives, the board of your organization really care about. And that's where things like executive dashboards come into play. You have to know what the executives know and what they care about, and also breaking down those silos, because if infection prevention is focusing solely on patient safety, despite a strategic vantage point to be able to see what quality does, what EVS does, what do they do in nutrition, if infection prevention only limits itself to patient safety, it's going to be hard in the long run to be able to communicate with the executives to see where infection prevention can really bring positive outcomes into any healthcare organization.
Thank you for that. It's always a joy and interesting to hear the different perspectives on how IP best practices bring value to the overall organization and its performance. So, what signals do you look for in teams that indicate work strain or burnout? Because this is in alignment with workforce strategy, which is integral in healthcare and in public health. So, prior to completing that question, of course, we've seen many research studies that have been issued and published related to the increase in burnout, not just amongst the medical team and the nursing team. However, it's also among infection prevention professionals. Of course, those that are nursing the stakeholders have that same background, but specifically with those with a title in infection prevention are experiencing burnout due to a plethora of reasons. So, what signals do you look for in teams that indicate workforce strain or burnout? And how can these be addressed at a system level? Missy, I'll go with you. Oh, Carol,
Me or Missy?
you can go, Carol. Thank you.
Okay. One thing I've noticed, the first thing that signals burnout is usually reduced motivation among teams. And also, this term that we've been hearing so many times since the COVID pandemic is quiet quitting. So we've seen many organizations, if there's no turnover, they're just quiet quitting. Teams are doing the bare minimum or not even doing the bare minimum, or there's consistent calling in sick for many reasons. So that's one of the first signals that you can notice that your workforce is strained to it above its capacity.
Thank you. Joi?
Well, I'd like to talk about that strain is, it's almost like you were listening to my presentation earlier when we were talking about um, the strain that the employees do feel and how you as leaders have to be in tune for that. And so it's paying attention to when people are communicating and you're having those staff meetings and you're hearing frustrations build, and then there's another thing that Carole kind of talked about, that maybe, just maybe, they're not voicing their frustrations anymore. They used to be very vocal. They've been communicating and not seeing the change because, as we spoke of, it really starts at the leadership level. So if we can't communicate effectively with our leaders, and if we are not sitting at the table, which I think is a big barrier for infection prevention, the people that are in those roles start to feel devalued. And when they feel devalued and they feel that it's then they start shutting down, or they look for work elsewhere where they will be valued, where they may have a seat at the table, and to where their objectives, as we just alluded to, Carol and Missy were talking about, this is a whole system. So it's not just the person, it is every department, and every role has a role to play. And so does the governance. So we really have to listen. And sometimes it's listening to what's being said. And then others, you have to be a little bit more in tune to try and pick up on those subtleties, to where now this person who used to be very vocal, who used to be advocating for certain things, is just presenting reports and going on about their business. And that leads to turnover and frustration, or, as she said, quietly quitting.
Absolutely. Missy, what are some signals that you can identify?
Sure, I agree with both of those perspectives. And I would add that one of the signals that I've seen of strain is when teams move from proactive work to purely reactive work. And the staff are constantly putting out fires, and then infection prevention practices start to slip. That seems to be always the first thing that goes, is the infection prevention. And you might start to see things like inconsistent cleaning, documentation gaps. You hear staff constantly saying, I don't have time to put on a gown. I don't have time to clean my hands. And those are usually signs that the system is under pressure. And I think addressing this means looking beyond the individual and really examining the process. Are the workflows realistic? Do they have the supplies and support that they need? I had a great example of this at a facility I worked, where I kept noticing people not wearing gowns for contact isolation. And finally, I just started asking questions. What is the deal with the gowns? You know, you've got gowns. I see them right there. Why aren't you wearing the gowns? And it was just more of an issue where we had some people that felt very uncomfortable in the gowns. They were hot. They didn't feel like they covered everything they needed covering. And so it just became an opportunity then for me to come in and say, okay, could we switch to a different gown? Could we just fix this problem and switch to a new gown? And we let them, tell us what kind of gowns they liked. Of course, you can't get 100%, agreement, but you can get close. And then at least you not only solve the problem, but like Joy said, they see that you are listening to them and you're trying to answer, you're trying to do what you can to help fix that problem. And sometimes it's not always that simple, but sometimes it is. Sometimes it's just they don't like the product for whatever reason. Get a different one. And then it's kind of a win-win. You fix the problem, but also it increases your credibility and starts building those relationships.
Thank you for sharing that. And one thing that I would add in addition to that is ambiguity within roles significantly stresses respective roles, including, public health professionals and infection preventionists. I know in my experience, and some may share the same experience, at the executive level, executive leaders have maybe a different view of what the infection prevention department and some other departments' role is within the overall framework of the organization. So ensuring that the system as a whole has clearly defined roles and responsibility in addition to ownership within workflows and processes, that can be a conduit to significantly reducing that level of strain as well. So, transitioning into the notion of how do we build resilient systems, how do resilient systems support both patient outcomes and team sustainability? Missy?
Yeah, so I think resilient systems is you put the pressure on a reliable process rather than an individual. And when infection prevention practices are built into everyday workflows, like standardized cleaning protocols or a strong hand hygiene program, it reduces variability. I like what Joy said earlier, where she said something similar to make it easy for them to comply. It should be so easy for them to be able to follow the infection prevention practices that they don't even have to think about it because it's not hard. I'm not having to go look for a hand hygiene dispenser that works. It's right here at the door. It's a no-brainer. I can walk by and do that. That type of reliability protects the patients because it reduces that chance of error, and it supports the staff because they're not constantly working around broken systems and trying to figure out how to get to what they need. I think Joy referenced that as well with, having all of the supplies that they need. They need to have everything at their fingertips so that they can do their specialized job, and they don't need to spend their brain power trying to figure out where is this, piece of equipment or where is this supply that I need. And I think having those resilient systems built in really does support the team, but then also ultimately it's going to support the patient because they're going to get better streamlined care.
Yes, having the policies, protocols, and guidelines already embedded within daily workflows and removing the guesswork out of how stakeholders are supposed to do their job is an integral way to address that. Joy, what are your thoughts?
Well, I love what Missy was saying because it really ties into the reality of that reliability. If you've got a system that's reliable, right? And as I've moved forward and worked with some facilities, it was as simple as ensuring that if you are setting up an isolation room and you're expecting someone to follow proper procedures, EVS staff, nursing staff, any staff that's walking in, nutritional dietary services, um, when they're coming in to the room and you know this person is on precautions, I just enhanced the process that they had and put up the visual cues, the CDC for how to don right in front of the cart that had the supplies. So what does it do? It takes the guesswork out of it. It streamlines the process and makes sure that everything, the par levels are set and the par levels are also on the cart so that there's a process for transition so that people are not having to guess. The same reminders for doffing are inside the patient room when you go in and right where they're supposed to take off and remove and put that stuff into the dirty area, that that process is clearly defined and posted. When we do that, it takes away the guesswork. You see better compliance. They're not having to think about it and the continual visual reminders. But I remiss if I'm not to talk about the auditing function to ensure that people understand and that they get the just-in-time training as well when you do see a miss. So it's truly a community of everybody, the whole ecosystem, the healthcare ecosystem, ensuring that the residents and the patients are receiving that highest quality of care, taking the guesswork out of it and making it easier for them. Labeling, just a color coded label. Here, this is the product you want to use. This color for this product, right? So if we're cleaning, we're using some type of bleach product and that color happens to be maybe blue on there. So on that item, put the little blue dot. People, mind, muscle, memory, make it easy for them. Take the guesswork out.
And Carol, what are your thoughts on building a resilient system?
Yes, so resilient systems, first, they all have a shared vision from the leadership to the person that's considered the least influential in an organization. Everyone knows we're working towards the same goal. So we know what we're supposed to do to make sure that our processes are in line. As Missy was mentioning, we don't rely on individual capacity, but on our processes that are already standardized and set up for success. Sorry, sometimes French comes to mix up with English and it makes me pause. So yes, so yeah, that shared vision is a very important thing for an organization to be resilient. An example I can give, I worked with an organization during the COVID pandemic, and it was amazing to see how it was withstanding pressure as an organization, even though everyone was stressed. There were some individuals who even wanted to quit their jobs but ended up staying because they could feel how cohesive the whole organization was, from the CEO to the supervisor in EVS, because they already had processes in place. They already knew what they were supposed to do. And once COVID-19 hit, no one was scrambling trying to figure out where policies were, what's the process for this, how do we start incident command, because everything was standardized and set up from the get-go. And you could also hear leaders from infection prevention, quality, nursing, nutrition, even. Everyone knew and kept reminding each other as co-workers, as co-leaders, this is our mission. This is our mission population. So whether we're tired or not, this is why we're doing this. And these organizations that are resilient and can withstand pressure, they also have their cultural mottos that always remind them that we're working towards our mission population. And that's why we keep doing what we're doing, even if we stress and things are not working.
Thank you for that. So, talking about innovation, of course, in healthcare, innovation is integral to consistently work toward advancing patient care and quality healthcare services. So, how should IP leaders prepare for emerging risks, including innovation and technology, inclusive of AI, while maintaining operational focus? Missy?
Yeah, I think that is a very timely question. And, infection prevention has always had to adapt to new risks. As I mentioned, I've been doing this for 25 years, and I think about when I first started and we used a DOS system called NIST to put in our HAIs to the CDC. And now we're using, now we have web-based systems. We have, phones now that we're using. We don't use pagers anymore. So I feel like we've seen these changes in technology, and I think AI is just the next evolution of that, and it's very exciting. I think it's very exciting for us in infection prevention, because I see that it can help take some of those tasks, administrative tasks, away from us that many of us don't want to do anyway. We want to focus on working with staff and working with patients. So I think as an IP, you should stay informed about how these tools can support things like surveillance or data analysis. But we also want to approach them with a risk assessment mindset, meaning, technology should support patient safety and staff workflow and not complicate it. We don't want to make things more complicated. We really want to weigh out the risk. Is this actually going to be worth it? If we implement this, are we going to really see some gains from doing this? At the same time, we can't lose focus on the fundamentals. And that's what I've seen happen many times over the years with the emergence of new technology. I think we've seen this with hand hygiene surveillance. We've seen this with environmental cleaning as new technologies have emerged. People keep looking for, okay, this is the big thing that's just going to do everything. And I just don't think that type of device or technology exists. I think we're always going to have to do the fundamentals. We're always going to have to clean our hands, clean the environment. antimicrobial stewardship. I think these core practices still remain the foundation of that infection prevention. And then these extra technologies are just another layer of protection and prevention that we can add on to those basic fundamentals.
Missy, you brought up a good point because many of us in these respective professions, we're experiencing this, right? We want to adopt and to even foster the culture that is conducive of implementing innovation and advanced technologies to streamline workflows. However, especially in infection prevention, we still want to be reminded that we have to remain and get back to the basics. I know post-COVID, that's something that has been reiterated a plethora of times, is getting back to the basics, but also ensuring that that is incorporated within the daily workflows is the basics of infection prevention and the notion that technology does not replace those practices. So, Joy, what are your thoughts related to this topic?
Well, I understand exactly what Missy was saying and how you just took it to the next level of this is a layered approach. It truly is a layered approach. The fundamentals have to stay the same in the sense of you still need a clinician to be able to review whatever, let's just say, AI is generating as far as your surveillance. So you don't have to work as hard as gathering that data. However, you do have to validate it. You do have to ensure that the information is correct. But it does allow you to spend the time focus on the areas that you as the IP can truly make the most impact and the most difference, which is going into the different areas, the units, the sterile processing areas, coordinating and making sure that everyone understands their role, facilitating um, the planning of new processes. And as she was talking about, we have to evaluate what we choose to invest in. The investment made in technology, everyone has a great product that they want to sell for IP. Let's be real. You go to the trade shows, you see them all. And there's a plethora of them out there. However, the reality is what specific tool would enhance our program? Because every facility is different. So when we're talking about risk assessments and things like that, and looking at your prior data, where have we fallen before? Where have we seen the drift and how can we bring that back? And we're starting out, we should be starting out doing it with the system's thought process from patterning each step and understanding, okay, this actual product may help me, or this new integration may assist us in taking the pressure off of this area, but we still have to make sure people are focused on doing the everyday basics because even though you may have a hand sanitizer tracking device on you, right? If you can afford that system, which some hospitals are utilizing, but they're not seeing the data translate into, hey, they're not doing better yet. What is the real problem? That didn't solve the problem. All it did was point out sometimes what we already knew. So, really taking the time to look at the technology and how it can truly impact that organization and the issues that they're having. And I think, like we said, it is a layered approach. It's like an onion. You've got your core, but then we're adding the layers between HVAC systems and this and that and all the other things that we can do to enhance that patient safety overall. And not just the patient safety, let's be real, we're talking staff and visitor safety as well. So it's really about the outcomes.
Carol, round out this conversation and share your insights as well related to how these innovations and technologies can maintain operational costs while preparing for emerging risks.
Yes, and as in the session, excuse me, in the session, we're also talking about emerging talent being an asset for their organizations. That made me think of not just early career infection preventionists, but any new talent coming into an organization. Uh, Healthcare and public health leaders are really at a time where they have a great opportunity. When you have new employees, they're usually eager, innovative, ready to accept any new tool. So with the age of AI, they actually have an opportunity to have those staff member enhance their organizations. And one thing I hear a lot, I discuss a lot with healthcare and public health senior leaders. And one thing I keep hearing till today is, okay, so if we implement this AI system or this AI tool, how many employees can we get rid of? But my answer is always that's not the main goal. That's not the main point. That's not even the point. That's not a priority. You should think about how this can enhance your organization because AI at the end of the day is still a tool. It's not a human, does not have critical thinking. It's coding, it's math. So you can't ask a calculator to think for you. So it's I believe leaders are really should really take advantage of this opportunity because we have emerging risks. The world is a village. People travel every day. We have infections spreading fast. We have limited funding. So AI comes at the right time because with limited funding, you can add those tools where you would hire, let's say, 20 contractors. You can hire one, and the contractor who's savvy in technology can use the AI tool. So that's where I see this as an opportunity for leaders to prepare for emerging risks. As Joy mentioned, AI can do surveillance for you, can help you analyze large sets of data that used to take us hours and days to just go through one specific metric. So those are opportunities that we can use to strengthen our organizations and prepare for any risks that's coming.
That is great knowledge there from the three of you. So let's shift gears a bit and learn more about some of the services or programs that Dumontel Healthcare Consulting provides. Carole, could you share the vision behind the powerful IP coaching program, along with its mission and how it supports infection prevention leaders and the results you're seeing in strengthening leadership impact and system outcomes?
Yes, I'll be happy to. So Powerful IP Coaching was created in 2024. Actually, it started in end of 2023 with a lot of data gathering, conversations with infection prevention leaders, healthcare leaders in public health as well, but it was mainly in healthcare. And this program was initially created to help with competency training for any organizations that had new infection preventionists. And the program has morphed since then, actually, because we have noticed that there's a in many orientation programs in infection prevention, there are some limits. There's a lot of technical trainings, and infection prevention is when we were collecting data, we're saying that even with technical training, they were still feeling lost. They were feeling like they couldn't make an impact in their organization because their work was focused on surveillance, on just education, or they would do a presentation, but nothing would happen because they didn't know how to communicate with the C-suites. They didn't know how to present information that would be impactful to patient outcome, on financial outcomes, and also just conversations that leaders do care about. So when we created this program, we added some of the competencies we noticed from, we did a self-assessment from any early career infection preventionist who was interested in the coaching program, and they all came from healthcare, any setting in healthcare and public health. And we saw there were some common competencies they felt like they still had some gaps in. And one thing we noticed that none of them had systems thinking or leadership skills. So that's one thing we added to our program as well. So we really focused on teaching them leadership skills and systems thinking and soft skills. And that's what makes this program a little different than orientation programs because when they get oriented in their healthcare facility, they tend to be thrown again into the water to just do the technical stuff. So the infection preventionists who came through this program the past 2 years have reported that they've been able to decrease infection risk by over 30% within 3 months. None of them had confidence, and many of them said that they started feeling confident to discuss with any leader within 6 months. One of them is actually working closely with the C-suite right now. Actually met with their chief nursing officer, who said that his training, they've never seen that with a new infection preventionist, because he's making changes at the organizational level. So this is one thing that this coaching program is doing to really support organization with the leadership training of uh, early career infection preventionists. And the program is expanding into partnering with universities to start training any new nurses or public health students who are interested in the infection prevention field. And we are adding modules and sessions on artificial intelligence, because that's how the world turns right now. So artificial intelligence is becoming part of this program as well.
Yes, and as you can hear, there's phenomenal work in the coaching program. If you're interested, definitely check that out. So we do have a question in the chat. I hope I'm pronouncing your name correctly, Ebo. Infection prevention is also often discussed in terms of compliance or regulatory expectations. How can leaders better measure and communicate the broader organizational value of infection prevention programs? Missy, what are your thoughts?
Yeah, I think this is a great question, and one that I've tried to address many times with new IPs, particularly in the long-term care setting, because I feel like oftentimes, you know, we have that tunnel vision for, well, I need to meet the regulation, I need to meet the regulation, where that's just one small piece of the purpose of the infection prevention program. The regulation is there to just ensure that we have the right program in place. But what comes first is establishing your infection prevention program. If you have your program in place and it is aligned with your facility, aligned with your strategic initiatives, then compliance with the regulations, I feel like, are going to fall into place, because the regulations support best practices. It's not the other way around. They don't drive what we do, we drive what they monitor. And so if you have a good program in place and it is facility specific, meaning you are aligned with the overall strategy of your leadership, then you shouldn't be worried when somebody comes in to audit your facility, because you know that you have the best program in place for your particular facility, and you're focused more on patients and residents, which is what is most important. It's not the regulations, it's the patients and the residents and doing what is best for them.
Those are some great points, Joy, and thank you for sharing that. Joy, what about you? What are your thoughts on that?
I agree with Missy, and I also look at it as, when we're talking about communicating the broader organizational value of infection prevention, it's really about looking at things that make sense to the organization on their level. And when I say the organization, I'm talking about the C-suite folks, that they understand exactly one infection prevention program has the impact of affecting your length of stay, your patient outcomes, your staff call outs, your reputation of your facility. Reality is, business, as Carol was speaking of earlier, healthcare is a business in the US. It just is. And so we have to understand and be business minded as we're communicating with our C-suite, with the people that are the leaders that can truly approve whatever resources that are needed, right? They have to understand how it's going to impact their bottom line and their success as an organization. It's really about outcomes. It's really about outcomes. but the outcomes affect them financially. So all of these areas, when we're talking about, and it doesn't matter the setting that you're in, if you have, as Missy alluded to, a strong infection prevention program and you support that, and how you communicate, and it comes down, we just got through talking about the powerful IP coaching program. That program was really instilled to help for the providers, right? The practitioners that are in the field to be able to effectively communicate with their leadership as well as the staff that they're dealing with, right? What are we trying to do? Why is it so important that our vaccination rates are up? Why is it so important that we have the right equipment? And that if this, as Missy talked about earlier, this particular item is not effective because there are barriers to the staff using it, that we as an organization decide that we're going to pilot some other products and let the staff have some buy-in on that. But communicating is the key. Being able to communicate the why behind the need is very important for any IP, whether they're new or whether they've been in the system for a while. The communication factor is a big deal.
Thank you, Joy. And then we have one additional follow-up question from Ebo. Infection prevention leaders often have visibility across the entire organization, but not always authority to influence enterprise decisions. What strategies have you seen successfully translate infection prevention insights into priorities that resonate with executive leaders?
Yeah,
Carole?
and so that, yes,
Mhm.
and I will answer both questions because they go hand in hand. And I did have this question in the morning during my keynote. As we've been saying here, in countries, especially like the US, healthcare is a business. So if you want, as an infection prevention leader, even as a new infection preventionist who's not leading a program, to influence or present infection prevention as an important part of the organization, you have to learn how to communicate with the C-suite, with the board, and know what they care about as businessmen and businesswomen, because they may care about patient safety, but it's not their priority. And we know that executives all have a dashboard, board members have a dashboard, they have specific priorities they're focused on, and from a business standpoint, they care about cost, whether they're making money or if they're saving money. And when we in healthcare and public health, we care about our clients who are our patients or the communities that we supporting. So those are some of the pillars we have to keep in mind, knowing what's on the executive dashboard to address those points and come up with better communication, better messaging to explain how infection prevention or operations, where there's quality, nursing, and I keep going back to nutrition because all those programs have an impact on a healthcare organization. Knowing how to make those departmental functions align with the business mindset and the business pillars that executive care about. So those are the strategies. I've been teaching new IPs in our program as well, and also talking with other infection prevention leaders. And those are the only ones that have been working in my experience.
Yes, one thing in the field of infection prevention that is absolutely integral, although some may not have the title of a leader, is building an executive presence and understanding what are the high priorities for executive leaders and reframing your presentation and or messaging to align with that to further bolster buy-in and acceptance from your needs within your respective department. And I will pivot because we are running low on time. Carole, I'm going to ask you this last question, and then I will close after you conclude your statement regarding this question. So, what's new about the Powerful IP Coaching Program in 2026, and how do these enhancements strengthen workforce development and system level alignment across healthcare and public health settings?
Yes, thank you. That's a great question. One of the new things in the Powerful IP program, as I mentioned previously, is the integration of artificial intelligence training for the program participants. And when we started the program, we were only talking to new infection preventionists, but now we talk with the leaders because the leaders are the ones who understand the importance of coaching their new IPs and teaching them leadership and systems thinking skills because they know that it's bringing impact in their organization. So that's one of the main things that's new. And also we are starting to establish partnerships with educational institutions, not just healthcare organizations, because we're seeing just in the pipeline of new infection prevention is there's a lot of fear, especially with AI coming, and also just within the industry right now, many leaders believe that the field will disappear, but I personally don't think it will disappear. I believe that those who will know how to utilize AI to enhance their work will be the ones to stay. So yeah, that's one of the main things. So those collaborations and the new part of the new curriculum.
Thank you, Carol. And before I start the closing message, does anyone have any questions? Additional questions or comments before we conclude? Okay, so just to round us out and to, this was a very, immersive conversation related to this topic. So just highlighting some of the major points that were noted is that embedding infection prevention within daily workflows to build a system focused on patient safety and quality healthcare services absolutely integral, and methodologies in building resilient systems were discussed. So thank you to the panelists for discussing and outlining those, and then also inquiring about what innovative technologies will enhance, not replace the replace practices within the organization, and then also learning further about the powerful IP coaching program. So definitely check that out and see the offerings of Dumontel Healthcare Consulting. So thank you everyone for attending this panel discussion and for honestly sharing your expertise. I really appreciate the thoughtfulness that all the panelists brought to this conversation. I hope everyone enjoys the rest of their day. Thank you.